This is the Patient Assessment Trauma Skills Evaluation. Your objective is to perform a rapid trauma assessment on a high-priority patient and to perform an assessment on a trauma patient to include vital signs. During this evaluation, you are authorized a stethoscope, a sphygmomanometer, a pen light, and a watch. Do you have any questions before we begin?
No.
Begin when you are ready.
The first thing I'm going to do is take the appropriate body substance isolation precautions. Next, I'm going to determine if my scene is safe. Is my scene safe?
Your scene is safe.
Now, I need to determine the mechanism of injury and nature of illness. What is the mechanism of injury and nature of illness?
You have a patient who fell and is unconscious.
Is this my only patient?
This is your only patient.
Since this is a high priority patient, I will request additional EMS assistance. Also, due to the mechanism of injury, I will consider stabilization of the spine. If I had my assistant here with me, I would have them maintain C-spine precautions. My patient is a young adult female who appears to be unresponsive. Ma'am, can you hear me? Ma'am.
Your patient is still unresponsive.
Since my patient is unresponsive, she cannot tell me her chief complaint, so I will use the context of the scene coupled with the mechanism of injury. Now, I'm going to assess her ABCs, her airway, breathing, and circulation. I'm going to open her airway using the jaw thrust maneuver. I'm going to maintain an open airway by inserting an oral adjunct as necessary. Next, I'm going to assess her breathing by watching her chest rise and fall, listening for breath sounds, and feeling her breath on my face. At this time, I would count my patient's respirations.
Your patient has 12 respirations per minute.
I would also consider the use of oxygen therapy at this time. Next, I'm going to palpate my patient's bilateral radial pulse and assess her skin. Does my patient have a radial pulse, and is her skin warm and dry to the touch?
Your patient does have a pulse. It is 100 beats per minute, and her skin is warm and dry to the touch.
Now, I'm going to perform a head-to-toe blood sweep.
You found no major bleeding.
Had I found any major bleeding, I would have stopped the bleeding and initiated shock management. I have determined that this is a high priority patient and I will transport. If my patient were responsive, I would attempt to obtain a sample history. But since she is not, I'm going to move on to my secondary assessment, beginning at the head and working my way down. I'm going to inspect for any signs of deformities, contusions, abrasions, punctures, penetrations, burns, tenderness, laceration, or swelling. Using my pen light, I'm going to assess her pupils to see if they are equal, round, and reactive to light. I'm also going to assess her mouth, nose, ears, and facial area for any signs of blood, CSF fluid, battle signs, raccoon eyes, or broken teeth. Moving down to her neck, I'm going to look for any signs of tracheal deviation or jugular vein distension. I'm also going to palpate the posterior of her spine, looking for any signs of step-off. At this point, I would apply a C-collar. Moving down to the chest, and inspect her clavicle for signs of fracture. I'm going to palpate her sternum and rib cage for any signs of crepitation or paradoxical movement. At this time, I will auscultate her chest. Next, I'm going to inspect and palpate the 4 quadrants of her abdomen. I'm going to check the stability of her pelvis. At the genitalia, I'm going to look for any signs of bleeding, defecation, urination, and if it were a male, priapism. I'm going to palpate her lower extremities, looking for any signs of crepitation. I'm also going to inspect, palpate, and assess her sensory motor and distal circulatory function.
Your patient has a pulse.
If she were responsive, I would ask her to move her toes. I'm going to do the same for the upper extremities. Again, I'm going to inspect, palpate, and assess her sensory motor and distal circulatory function.
Your patient has a pulse.
If she were responsive, I would ask her to move her fingers at this time. I'm now going to log roll my patient. I'm going to assess her posterior and spine for any signs of injury. At this point, I'm going to obtain a set of baseline vital signs to include blood pressure, pulse, and respirations. I would now manage any secondary injuries or wounds that I had found during my assessment. During transport, I will reassess any interventions that I've made, check vital signs every 5 to 15 minutes, check for any changes in my patient's status, and once again, attempt to obtain a sample history. Lastly, I will provide report to the next echelon of care.
Congratulations. This concludes your patient assessment trauma skills evaluation.